here. Okay. Knock, knock. I'm gonna close the door for privacy and wash my hands. Hi, my name is Sarah. I'm gonna be your nurse for today. Can I have you state your name and date of birth? We have Boyd Dubois, date of birth 4/30. Do you have any allergies, Mr. Dubois? States shellfish, and the patient is wearing an allergy band for shellfish. I'm going to verify the MR number 772-7893, 772-7893. All right, Mr. Dubois, we're going to be doing a full head-to-toe assessment on you today. Do you know where you are today? Fortis Hospital. Do you know why you're here? Okay, and do you know what date it is? Okay, it's 5/20. Alrighty, grab this stuff. Alrighty, I'm gonna shine this in your eyes. And follow the light for me. Okay, pupils are equal, round, and reactive to light, and they're also able to accommodate. I'm gonna check oral mucosa. Mucosa is pink, moist, and intact. I'm going to check for tenting of the skin, and it is non-tenting. Okay. Mr. Dubois, have you had a cough recently? Yes? Okay. Are you able to cough anything up? Yes? Okay, so cough is productive. And what's the color of that? White and clear. And the consistency, you said, is thin. And if you could cough anything up into a little medicine cup, can you estimate how much that would be? 5 milliliters. Okay, I'm going to assess the thorax. And the chest rises symmetrically. I'm going to listen to 8 places on the front and then 10 on the back. Okay. Lung sounds are clear, and the respirations are regular rate and rhythm. They're also unlabored. Okay, now I'm going to listen to the heart, starting with the second intercostal space to the left, which is the aortic. S1, S2 noted. Second intercostal space to the right is the pulmonic, S1, S2. Third intercostal space is Erb's point, S1, S2. Fourth intercostal space is the tricuspid, S1, S2. Fifth intercostal space, midclavicular line, is the mitral, S1, S2. And I would flip this over and listen to the apical pulse for a full minute. We are going to simulate that a full minute has passed, and the apical pulse is about 92 beats per minute, and it's regular. Okay, so we are going to move on. I'm going to check brachial pulses on both sides to check for symmetry, and it is +2 regular. Radial pulse on both sides is +2 regular. Okay, can you squeeze my hands for me? Push down and then pull up. And strength is +5. I'm going to check capillary refill on both sides, which is less than 3 seconds. Okay, I'm going to assess the IV site now. The dressing is clean, dry, and intact. There's no redness, signs of infiltration, or any swelling, and it is dated, and I would go ahead and flush the IV line to check for patency. Okay. Mr. Dubois, when was your last bowel movement? You're not sure? Okay. And what was the color of that? Brown. The consistency? Formed. Was there any unusual odor? Normal? Okay. And about how much? Was it small? Was it big? Was it medium? It was medium. Okay. Going to assess the abdomen. It is flat and non-distended. Going to auscultate 4 quadrants, starting with the lower right quadrant. Vowel sounds are active, upper right quadrant. Vowel sounds are active, upper left quadrant. Vowel sounds are active, lower left quadrant. Vowel sounds are active. Okay. I'm going to palpate, starting with the lower right quadrant. Tell me if you have any pain or tenderness. No pain. Upper right, no pain. Upper left, no pain. Lower left, no pain. All right, so patient denies pain or tenderness when palpating. Okay. So can you tell me when was the last time you urinated? Way before your surgery. Okay. And the color? Yellow. Was there any unusual odor? Patient states that there was none. The clarity, was it clear? Was it cloudy? It's clear. Okay, and did you have any pain, urgency, or frequency? You just had a decrease in frequency? Okay. So now I'm going to assess the genitalia. So I'm just going to assess and pull the patient's gown up. The patient does not have any lesions, edema, abnormalities, discharge, or any sores. So I would put that back down. Going to check for edema on both sides, and there is no edema noted on both sides. The skin is warm, dry, the color is appropriate to ethnicity, and there's no lesions or any breakdown, anything like that. So I'm going to wash my hands. Put on some gloves. Okay. I'm going to start by assessing the dorsalis pedis pulse on both sides, and it is +2 bilaterally. Posterior tibialis pulse is +2 bilaterally. Checking for capillary refill, that is less than 3 seconds. Can you push down for me and pull up? Okay, and then strength in the lower right extremity is +4, and in the left lower extremity is +5. So I'm going to take these off. Going to wash my hands again. All right, Mr. Dubois, we are all finished. Is there anything else I can do for you? Okay, so I'm going to put the bed down, the rails up, and here is your call bell. And I'm going to wash my hands and get ready to call the doctor.